Okay, now write your name.
9-year-old Justin Perales was right-handed, but now he uses his left.
Good job.
It's a long story.
Justin lets his mom and dad explain why.
July 13th, 2013, we decided to go up to the State Museum at the Capitol.
We did the full 3 floors, got up to the top. Justin started complaining that his head hurt.
We thought, you know, he didn't eat that morning. He decided not to eat. And we thought it might have been, you know, from hunger or something of that nature.
I got crackers and juice, gave him that, and he just started yelling, you know, it hurts really bad, it hurts, so took him into the bathroom.
And I noticed that the right side isn't moving and is dragging his feet, and my wife is trying to carry him over to the bathroom.
And he just kind of blacks out, so I gotta carry him out of the bathroom. And I go to Eddie. Eddie was coming out of the little cafeteria snack room, and I said, we need to get him to the hospital. He's not responding right now.
Eddie finds the best route and takes him to the nearest hospital.
So I walked in as I was carrying him, and I just said to the receptionist, we need help. He's not responding. He's just limp. They took him in right away.
10 to 15 minutes later, a doctor comes out. He comes back towards me and says, you know, your son had a hemorrhage in the brain, he's bleeding, and Lifeline from Penn State Hershey Children's is coming to pick him up. And I said to myself, I just thought it was a headache.
On his initial presentation to the hospital, he had severe brain swelling and he had a major brain hemorrhage. On an examination scale, a very severe brain injury, and he was close to being in a brain death condition. He did not respond a lot to verbal stimulation or painful stimulation. His pupils did not work to light, which is a very ominous sign of a very bad comatose condition. Most of the time, this does not reverse.
Doctor comes and asks questions versus, did he fall on his head? Does he have any prior health conditions?
Did he take some medication that he shouldn't have? It's things that they ask you that make you kind of think, okay, what happened to cause this?
Our initial response was to do an emergency procedure trying to reverse the elevated pressure in the head that he had by securing a tube into the fluid spaces in the brain and try to relieve the pressure. I also explained to them that the reason why he's bled into the brain was from a vessel malformation that he had, which is called an AVM, which stands for arteriovenous malformation. It is basically when a vessel that does not form well, it causes a nidus of entangled vessels with lots of branching of the vessels that has a higher chance of bleeding in the brain. We induced a medical coma and tried to stabilize the pressures in the head so he does not get into a more problematic condition.
And they did tell us that the first 72 hours were going to be critical. They had to keep the pressure and the swelling down in his brain, so that was pretty hard to hear. He had 3 days of just hoping that he pulled through.
I started a Facebook page just to seek prayer for my son's situation, and then it went from 50 to 2,600 people because I couldn't make phone calls to keep in contact with family in the hospital.
It takes 2 long weeks of watching and waiting before doctors can operate and remove the AVM.
We went in after he had his brain swelling under control and his pressures were fine. With the microscope, we were able to remove about a golf ball sized amount of anomalous or abnormal vessels that were involving the superficial and the deep parts of the brain tissue.
The surgery took a lot of hours that day. We were at the waiting room for, I don't know, between 8 to 10 hours probably. Dr. Rizzi comes out and says that we were successful in the surgery.
The very next day, the unthinkable happens. Justin is rushed into the operating room.
He had just gotten out of surgery, so you're already frail, and then to have to go in and do another surgery to get that fixed, that was kind of scary.
It was just a blow to us where we got through this 8 to 10 hour day, and now this next day another vein just burst out of nowhere, and it was becoming a little bit overwhelming at the time.
So we had to take him emergently to the operating room again and evacuate the blood clot, and we found out another small vessel that we had to excise or remove. He did well following that procedure.
Justin spends 5 weeks in the hospital and then goes to Penn State Hershey Rehabilitation Hospital.
We took him over there and he was basically wheelchair bound at the time. The only thing they could move was the left side. He couldn't eat, he couldn't move his hand, the right hand, he couldn't move the right leg, anything. Everything was totally paralyzed on the right side of his body.
He had to relearn pretty much everything. He had to relearn how to talk, how to walk. Anything you do as you learn when you're growing up, he just had to relearn everything.
Speech comes first with some touching words.
I get this voice note and I play it and I hear Justin just, I love you. And I called Eddie, I said, stop playing with me. I said, how did you do that? Like, how did you get him? He's like, no, that was actually him.
Each day gets better as Justin improves.
We were able to walk within about 2.5 weeks into the therapy program. First time, I think he took maybe about 5-6 steps at the time.
Soon the number of steps increases.
He did therapy and took his first 100 steps. I mean, he went over 100. My husband had to do over 100, but it was like, that was huge for us.
I would have never imagined him to walk or use his limb that well, seeing him now. Miracles can happen. In his case, he did a tremendous recovery.
And the recovery continues at home. Eddie and Addie work around the clock with Justin. They know their son is capable of doing great things.
He just gets me every time when he says, I'm a go with the flow kind of guy, because that's how his personality is. He just goes with it, he runs with it, and I think that's what helped get us to where we're at now.
Sometimes I do catch myself looking at him, and I'm super proud of him because he's come a long way and he set an example to a lot of people. And there's a lot of people that reach out to me, adults, and they just, your son motivates me. That's the purpose now, to help other people and put other people first.